All right, so going back to our case, that page. So we get a page, patient Jones' heart rate's in the 170s. We find out that he's stable. What's the next thing you want to do? You definitely want to go see the patient, and then you definitely want to get an EKG. And this is where we start creating this kind of algorithm for determining how to figure out what this tachycardia is going to be and how you want to treat it. So the first thing we decide is obviously stable and unstable. So if this patient has a stable tachycardia, the next way you break down tachycardias is with narrow complex and wide complex. And this is referring to the QRS complex. So we're going to first start off on the left side here with stable narrow complex tachycardias. And narrow complex can be broken down into two other categories. It could be broken down into regular and irregular. And this means the QRS complexes. So are they regularly spaced or are they irregularly spaced? So the first one we're going to talk about are stable, narrow complex, regular tachycardias. And there's three that you should know. They're sinus tach, atrial tach, and SVTs. So sinus tach. Sinus tach, first of all, can be caused by many different things. Patients are in pain, they're in the hospital for an infection, so they're septic, they're fevering, that's causing their heart rate to go up, they're anxious, they're stressed out, or two things that are really important to not forget about are they could be having a pulmonary embolism or they could be having a heart attack. So those are important things to kind of keep on your differential whenever you have a patient with sinus tachycardia. Other things to check for are thyroid levels, and then are they taking any stimulants or any other drugs that could be increasing their heart rate. So on an EKG, patients with sinus tachycardia have a normal sinus, basically a normal sinus rhythm, like the sinus node is the one that's creating the tachycardia, so you will see a P before every QRS. The thing though is that sometimes those P waves, if the heart rate is going very fast, could be hidden in the preceding T waves, so that's what makes it tricky. However, the patient is on telemetry. One of the things that you could do is actually you could look at the telemetry strip, and if you see that there's a steady rise in heart rate over a few minutes or a few hours, you know that this is going to be sinus tachycardia and not something like an SVT, because patients with an SVT on the telemetry will actually see a rapid spike to that heart rate that they're at. So they'll be at 80 beats per minute and then all of a sudden they're at 170. While with sinus tachycardia, you see this steady increase from 80 beats per minute to like 100 to 120 to 150 to whatever they may be. So let's take a look at an example. So looking at this EKG and looking at the rhythm strip at the bottom here, we try to find the P waves. So we could see that there's these kind of two bumps. So the first bump is probably the T wave and the second bump is the P wave. And we see that they're before every QRS complex. So this is coming from the sinus node. If we look at how fast this is going, this is a little bit less than 2 boxes, so it's more than 150 beats per minute. So this is a classic sinus tachycardia. The way you treat these patients is if you find out this is a sinus tachycardia, you want to reverse the cause. So you give them Tylenol for fevers, for infections, you give them antibiotics. If they are having a PE, start them on heparin. If they're having a heart attack, take them to a cath lab, check their thyroid function, either start them on treatment or if they're in thyroid storm, treat them for that. And then it's also okay to give them anxiety medications. If this is due to an anxiety episode, they might need some benzos or hydroxyzine to kind of calm them down, to kind of help lower some of that anxiety and stress level. So that's sinus tachycardia.